Good morning and welcome to this month's edition of Policymakers Live. It's great to see everybody. I'm excited to have Representative Jay Livingstone as our guest today. Welcome, Representative.
Good morning. Thanks for having me.
Absolutely. It's our pleasure. Before we get started, I wanted to thank today's sponsor, Sanofi. Thank you for sponsoring and thank you for helping make sure that we're able to continue to produce these high quality events and connect our membership with policymakers both on the state and federal level. Again, excited to have Representative Livingstone today. He is serving in his fifth term representing the 8th Suffolk District, which incorporates much of Boston and Cambridge. He is the newly appointed vice chair of the Joint Committee on Healthcare Financing, so very relevant to the life sciences industry, and is also a member of the Joint Committee on Higher Education and the Joint Committee on the Judiciary. Representative, how are you? How's your family doing?
Doing great, doing great. We're excited that because of the life science industry, my wife and I have been fully vaccinated and society is starting to get back to where we were. And it's wonderful to see.
It is absolutely a great feeling. I feel like every day brings us a little closer to normalcy. How's the start of the session been so far?
Very good. We have a new speaker, Speaker Mariano, who is a man of action. And so it's been a very busy session. We've already passed major climate bill on climate change, several bills regarding COVID, and a large bill that I think we're going to talk about later regarding unemployment fixes, especially on the business side.
Yeah, absolutely. I think as we've been watching from the outside, it does seem like there's a lot going on in the early stages of the sessions. And I know our industry is looking forward to working with you in your new role and with the legislature as the session moves along. We've talked a little bit in the past, Representative, but the cluster, which does exist in a lot of ways in your district, especially the piece of Cambridge, but also in Boston, predominantly is made up of smaller early stage biotech companies. So these are companies that are pre-revenue, don't have products on the market. They are taking big bets on the riskiest science and are privately funded. So there's big risks going on, but we're already seeing big rewards. I mean, COVID vaccine, I think, is the #1 example. The core of that science that turned into the COVID vaccines, especially in the mRNA vaccines, came from biotech companies. This is research that's been done for 10+ years at great risk and in a lot of cases with a lot of skepticism. mRNA as a therapeutic, especially early on, I think a lot of people thought was going to be a failure. But as you alluded to, you can see where it's brought us to today, and that's thanks to biotech companies like Moderna and others, which is a Massachusetts homegrown company. From your perspective, how are policymakers at the State House viewing the biotech industry right now, based on where we are?
I think it's never been more favorable, to be frank. I think there's a lot of pride that Moderna is based in Massachusetts, that the vaccine that it's distributing was first created in Massachusetts by Massachusetts residents. And the Pfizer vaccine, one of the biggest manufacturing plants, is also in Massachusetts. That there's such a Massachusetts connection to this, what is going to be hopefully a worldwide success in distribution, and has been an incredible success here in Massachusetts. And so I think right now there's probably never been a better feeling or more appreciation for the life science companies. And as we get back to normal, hopefully that goodwill continues.
That's great to hear. And from our perspective, industry voice, we feel it's really incumbent upon us to make sure that story is well understood, not only in the short term, but in the longer term, and not only as it relates to COVID, but as it relates to all the other rare and unmet medical needs that still exist, that our industry wakes up every day trying to fight and find cures and solutions to. Thinking about the future of our industry a little bit, we think a lot about competitiveness and where we are as Massachusetts. We are really the world leader in the life sciences industry. There's nowhere better to launch, grow, and scale a life sciences company, especially biotech R&D. But there's no doubt that other states are becoming more competitive than ever before in terms of attracting those same companies that usually would come to Massachusetts. And there's never really one sole factor that leads to those decisions, but we know for sure that things like transportation, housing, lab space, and workforce all add up to a story. And we know that legislature has been thinking a lot about these issues, and certainly not a lot of short-term fixes necessarily are available here. But when you think about things like transportation and housing in particular, what do you think the legislature's view of that, especially as we're returning to more of a normalcy?
Yeah, well, I was selected in 2013, and my first vote in the in the legislature was to vote to raise the gas tax to fund improvements to our transportation infrastructure system. And as I look back on that moment, I was sitting there in my chair thinking, this is unbelievable start to my career. I've one of the most infrastructure heavy districts where I've like 12 to 15 T stations. North Station is in my district. Back Bay Station is a couple blocks outside my district. Every part of the T system goes through my district, except I think the Silver Line. And so I spent a lot of time dealing with MassDOT, the MBTA, and DCR, and thinking about these issues. I was surprised how long it takes to translate those votes in the legislature to infrastructure changes on the ground. And then even when you have the best laid plans, within a year, in 2014, the Patrick administration ordered new red line trains, orange line trains, and started the process of looking to replace the green line. And the new trains, they'll be able to run faster, they'll be able to run them closer together, and they're bigger, which is all those things are a great relief.
Yeah.
But the rollout of those, there's been so many problems that the entire fleet should have been replaced by now under the original plan, and it's still years away. And so we just passed in January another major transportation bill to spend $18 billion in our transportation system over the next 7 years. And so I was meeting this morning with DCR about a bunch of projects in my district on making sure that this area gets its share of the funding. And so there's still, I think, a lot of excitement. I think the Baker administration has done well the last few years to replace all the infrastructure on some of these lines and really use the pandemic when no one was using it to just close lines and do the fixes we needed. So like the blue line, I think was closed for a month last April. Very few people, I think, noticed.
Yeah.
Because the roads were cleared, you could run buses to replace it in a way that you couldn't in normal times. And that work saved 3 years of nights and weekends work on the blue line. And so those and that meant changing, from the studs, keeping the tracks in place, to the tracks, to the ties, to every part of it. And so I think we're getting towards a more reliable system, a larger capacity system that runs more frequently. And there's still a lot of work to do, but this is something that I spend a disproportionate amount of my time thinking about and working on.
Yeah, I mean, it's so great to hear. In 2019, I remember we used the word future-proof a lot, especially thinking about places like the Kendall Square stop on the Red Line, which a large majority of life sciences workforce that comes into Kendall Square every day rides. Back in 2019, as you know well, that station was well above capacity on a daily basis. And we were trying to, encourage the legislature and administration to think big, think about the next 5, 10, 20 years and making sure that capacity increases in order to keep up. And I know you've been a leader on that, so thank you for that. It remains as critical as ever. And, as we circle back here 2 years later, want to be continuing to think about thinking big and driving into Kendall Square already, even though traffic is not back yet, I suppose, driving into Kendall Square still stinks already. And we should be encouraging everybody to figure out alternative ways to get to work here, especially if they're coming in Kendall Square.
Yeah, I think that's right. But I think people aren't yet back to using public transit in the way they were before, which is putting more people in their cars. And in the last couple of weeks, there's been, I've seen and heard about significant traffic in and around my district that wasn't existing a month ago. And as more and more businesses are returning to in-person work, you're going to see that more. The red line is more reliable than it was in 2019. And as the new trains get put on the tracks, there were a bunch of new ones. They had to pull them off because of some mechanical issues.
Yeah.
As the new trains get put on the tracks, the capacity is going to increase by 40%.
Wow.
Of the system. And so that's a substantial increase.
That's amazing. Yeah, I think you're right. There needs to be more done to get people back on public transit faster, because it is safe and it is a great way to get to work. Thinking again, about this sort of return to normalcy, return to office, the state of emergency is being repealed pretty soon. And I know the legislature is already thinking about what needs to be done and what's going to stay around in terms of things that were passed through those emergency orders. So, things like telehealth, which impacts our industry, impacts patients in a major way, are top of mind for us. There's also things like, outdoor dining, cocktails. There's a whole litany of issues that are coming up. How's the House thinking about that? And what do you think a timeline looks like for trying to resolve those issues?
So some of the things were made permanent, and some of the things I think you're going to see become permanent. I think in the next couple of weeks, the House and the Senate are going to come up with a bill to make more things permanent, particularly around the restaurant space. And I think outdoor dining is at the top of the list. There is no, this was an awful year, but the brightest thing that came out of it, I think, was outdoor dining, where people really saw what a tremendous impact, positive impact that had on their communities.
Yeah.
I think that's going to continue.
Yeah, well, that's good to hear. I went to a restaurant in Somerville, and I think they're probably doing more business because they had 12 seats indoors and probably 20 seats outdoors.
Right. Yeah, it's great, and it's a better experience.
Yeah,
it's
absolutely.
Putting it on the street, and it's making a more pedestrian-friendly street. So I'm a big fan, and I'm a big advocate for continuing it. But I haven't heard any pushback from my colleagues either.
It's great to hear. We've done a survey recently of our membership. I know there's been a recent survey from the Mass Business Roundtable as well, thinking about what employers are going to do and what employees are thinking in terms of returning to the office. We're finding that employees do want to be in the office, but certainly they don't want to be there 5 days a week anymore. Maybe 3 days a week with 2 days remote, something like that might be a trend. And I think that's going to end up being a competitiveness issue inter-industry as well. If you're looking at a company that wants you to be in an office 5 days a week, that could be a tough sell for certain employees. Are you hearing from the commercial real estate folks, landlords, et cetera, about how they're thinking about people coming back to the office?
Yeah, I think so, and no one knows what's going to happen. I think you're going to see office space be different. You're going to see more kind of hoteling of office space. There's space people can work when they're in the office, but every industry is different. And throughout the pandemic, when I traveled around Kendall Square, it wasn't that different from pre-pandemic because so many people were working in lab space in that area, trying to produce the vaccines that have been successful.
Yeah.
It's whereas in other parts of my district, like in Back Bay, there's been a clear drop in office space being used, particularly like in the Prudential Center. And so I think depending on the industry, some are going to translate more to remote work than others. I think what I've seen is more use of what would have been a commercial office space be converted to lab space. There's a huge project right outside my district in Fenway where that conversion's happened.
Yeah.
And you're going to, and more, I think that's going to be the result. but businesses, I think, are going to feel this way. I was talking to my wife about it, and her company, it's a real estate development company. They were 100%. You got to work in the office Monday through Friday, and I think they've seen that might not be required as much. That it's helpful at times, and so they're trying to figure it out. And I think there's a lot of companies a lot of business executives that I talk to are kind of in that. There was an assumption that having everybody in the same space made a lot of sense, and they're trying to figure out if that's actually true.
Yeah, it's going to be, I agree with you. It's going to be really interesting to see. And I think it'll be different by industry, by business type, even by role within your company. Whether you're more productive at home or you need to be in a group setting, you need to be in some sort of collaborative setting. I think there's a lot of unanswered questions. I mean, the issue you raised around lab space is certainly a bright spot. I think another bright spot of COVID is that the lab space growth, continues pretty significantly. I heard today there's another 6 million square feet of lab space in the pipeline in the coming years across all of Massachusetts. And a lot of that's being built on spec now, which is pretty incredible. We don't even have tenants lined up, but we know the demand is still there. And I think that's a great sign for our industry. And it's going to point again how important it is that we do everything we can, both as an industry and a state, to figure out how we get that next generation of workforce into that talent pipeline, because we're going to need every last smart person around, no matter what, to be engaged and interested in working in the life sciences. A big thing that's impacts every business, and including our industry as well, is what's been going on with the unemployment insurance and the significant rate increases that hit at the beginning of the year. So I want to thank you and the House's leadership on making sure there's substantive fixes have been passed quickly. Makes a big difference, pushing out some of these payments until later into the year and figuring out new payment methods for the solvency fund, for example, greatly benefit all of us, and I think is going to make business more successful. So I just wanted to take a minute and thank you for that.
Thanks. Right now is the worst time to have a significant tax increase on businesses as they're especially a lot of them that are just starting to operate again. There's some restaurants in my district that are open now for the first time since last March.
Yeah.
And then be hit with substantially new costs. I think we made the right decision, and we thought we had a better fix a few months ago. Now I've been assured that we've done the fix. It's on Baker's desk, and hopefully he signs that into law shortly.
Yeah, again, that's going to make a big difference. And life sciences has some significant employers in terms of size, but also primarily under 50 employee companies. So those dollars really add up quickly. Yeah. Looking at Boston, there's a big mayor's race this year, and it seems like forever we haven't had a big open mayor's race, but it actually wasn't that long ago. I know you've been in Boston a long time. How do you see the mayor's race this year playing out? And what are your thoughts on that?
I think we have an incredible field of candidates. I mean, it's 6 very diverse, very talented individuals who have had a lot of success. Who are all running productive campaigns, who are all raising the money to be a front runner, and it's going to be interesting to see how it plays out. I have a colleague in the race who's I guess was endorsed by the speaker this morning, and I'm interested to see what he has. He has incredible background. I think it's going to be a close race, and I think it's half over. It's been like
amazing
since Mayor Walsh said he was going to accept the job from President Biden to be Secretary of Labor. The election's about 4 months away, but it still seems incredibly early. And I think most people I talk to are impressed by the field and undecided.
Yeah, that makes total sense. I think the timeline you bring up is pretty fascinating. It is happening incredibly quickly, and with such a big field, it's going to be interesting to see how those candidates are able to get to the numbers that they're shooting for in such a split election. I want to encourage everybody to ask questions directly into the YouTube stream for the representative here. We did just get one from the audience. what do you see as your committee priorities this session, your role as Vice Chair of Healthcare Financing and member of the Higher Education Committee?
Thanks. For healthcare finance, I think there's a few things that have been bubbling. Zach mentioned at the beginning, telehealth. We made permanent some changes in January that were temporary, but I think there's still more we can do in that space. That's another thing that people were very suspicious of prior to the pandemic, that we just needed to do, and it worked out better than people anticipated. The healthcare costs are something that we get probably the most complaints about, questions about. Lowering healthcare costs in Massachusetts, I'm learning, is one of the most complicated things. If there was an easy answer, it would have been done. And in figuring out, so for myself personally, talking to as many people as possible about what they see as the essential things in our system, what they see as drivers of unnecessary costs. And it's been fascinating to learn and hear, meeting with Zach to really understand the drug pricing much better and some of the drivers there and the complications. It was incredibly helpful. There's a ton of parts of this equation. And I know the speaker views it as, making sure that the lowest cost hospitals and lowest cost services in our state have the resources to be successful. And that is that's the one thing I know that we're going to focus on. He's been a huge advocate of community hospitals, but looking at the overall ecosystem and figuring out if there's ways to make improvements to just save on insurance premiums, because that's what's hitting people.
Yeah, I mean, I think you've hit the nail on the head. I know when we spoke previously, we talked a little bit about the CHIA report that came out this year, and looking at that data carefully to see where the cost drivers are and where they may not be. Prescription drug spending, net of rebates was the one driver that was under the benchmark for the time period studied in there, 2018 to 2019. So when the legislature is thinking about drug pricing and legislation related to that, we've talked about a little bit, making sure that we're trying to address the problems that exist. And I think when you're thinking about costs, it is what consumers are paying, whether it's those insurance premiums or whatever that's out-of-pocket costs when they get to their pharmacy, which can be pretty significant. We have another question here about vaccine hesitancy and equity. The state has certainly done well in terms of total vaccination numbers, but we do know there are some disparities amongst vulnerable communities that continue to exist. Is that something the committee is thinking about, something the House is thinking about, and how they terms the role they may play in addressing that issue on an ongoing basis?
Yeah, it's something that the House is keeping a close eye on, and I personally have kept a close eye on. Talking to the Baker administration, I think I've been pleased that with some of the efforts, especially CIC, which operated Office Space and has now become the biggest testing organization, and then became the biggest vaccine distributor.
Yeah.
A lot of their work has been just incredible. I just took a tour of the Hines, where actually I got vaccine twice there, but also took a tour as a local elected official, and it's just so impressed with the mobile deployment, the different marketing techniques to get at underserved populations, and then also their creativity. Like they're offering to have schools come tour the Hines and then give every kid a vaccine, and or come where they'll do a presentation and then they'll give every kid a vaccine that, with the parents consenting, and just those really just creative thought leaders that I always expect when I deal with, Kendall Square, to get at how do we we reach these people that otherwise aren't going to be reached. And when I've talked to doctors, Mass General's in my district, and there's a lot of doctors doing work in Chelsea. With them a while back, where they were incredibly concerned. They were hearing in the press there was vaccine hesitancy in like Chelsea with communities of color, and it wasn't their experience at all. That it was the people didn't know how to access the vaccine, and we started figuring out how to get the Baker's administration attention. Right then, CIC and the administration announced mobile distribution in Chelsea, which has really addressed that and really changed the narrative that was happening there. I think now the challenge for the state is to get at these pockets that still exist in the state more effectively than they've been doing, because it has been a focus, and make sure that it's not vaccine hesitancy as access hesitancy, as I'm not sure how to get that. It was inconvenient for me, those type of questions, and to really get at everybody. Because when they've done polling for somebody saying, I don't want this, it's really low. It's like 13%.
Right.
And we're the number of people that haven't gotten the vaccine is much higher than that. And so I think there's a big delta of people that we can still get to.
Yeah, I think I couldn't agree more. I think going to where people are and creating access for them makes so much sense. And especially when you think about populations where taking time off work is not an option, addressing concerns about side effects, after that second shot, and whether you're gonna have to take more time off work. How do you get around barriers like that? For those hourly workers, for example, that's a significant issue and completely understandable. But I think you're right. The polling shows that the hesitancy rates are declining significantly. So how do we meet their needs in a way that's meaningful?
Yeah. When we did the unemployment bill, we also did a paid family leave bill, we have a paid family leave program we passed several years ago that went into effect in January. That has been, employees have been getting a deduction on their paycheck.
Right.
Participating have been paying as they pay paychecks. And the trust fund was building up reserves. We've modified it to deal with more of the fact pattern that you're dealing with, somehow related to COVID. And where the state has taken, I think it was CARES Act money, and set that aside to fund that program. So there's no more obligation on employees or on employers, but it's going to be, people are going to be able to take advantage of it. It was passed in our original bill. Governor Baker sent that back with amendments to really weaken it and exclude a lot of municipal workers. We rejected those amendments and sent it back, and it's on his desk as part of the overall fix to help businesses with unemployment rates.
Oh, that's really good to hear. I wasn't aware of that. Thank you for sharing that. We have another question. We talked with Chairman Lon recently, and he said one of his priorities this session will be around mental health. Is that a priority you share? And can you talk to a little bit about mental health legislation?
Yeah, there's some experts in the legislature on this who I tend to defer to on mental health issues, but mental health has been an issue that we've always, in my time in the legislature, we've always put some more money towards some mental health programs, recognizing there aren't enough beds, there aren't enough places for people to go to get help. And I think right now there's a greater recognition that the last year has brought more mental health issues to the forefront than people before recognized or existed. So I think there's going to be a lot of discussion in the legislature on how exactly to address that. I don't know that there's one bill right now that's the silver bullet.
Yeah.
But I think that that is going to be a big priority.
Yeah, I mean, I think your kids are probably a similar age to mine. Our pediatrician said that he's done more mental health referrals over the last year than he's done in his whole career for kids. And if you think about that population, they've had the weirdest year imaginable and can hardly understand why. And I think with school coming back and full time in September, this is certainly not over, especially for the pediatric population. But it's good to hear it's a priority. We know that it crosses all populations in different ways. We look forward to working with the legislature on how our industry may be able to support that as well.
Yeah. And if anyone has for what we should be doing, please let us know. Like we don't have a monopoly of ideas, and some of the best ideas that I've pursued in the legislature have come from discussions like this.
Thank you. Appreciate that. I think we have time for just a few more questions, Representative. The last one here, what are your thoughts on the American Rescue Plan, and how is the House thinking about spending that money? I know it's somewhat early, but sounds like about $5.6 billion coming our way, which is certainly significant. There's some guardrails on that, but have you had conversations about how some of that funds may be used?
Yeah, there's a lot of excitement about that. It's a tremendous opportunity at the state level and at municipal levels. The state is getting over $5.5 billion, but municipalities are getting, I think, over $4.5 billion total for the state. And figuring out kind of one-time priorities and then things that you can supplement. Anything that you bake into the budget, you'd have to fund after this money runs out, and so you have to be really careful with that.
Yeah.
We just had the budget process in the House a few weeks ago. The Senate is having its budget debate right now, and those dollars really set our state dollars, and there's going to be a separate budget process for this. I understand it's coming up in the next month. And some of there's some earmarked money in that. So that there's, from what I understand, about $700 or $800 million for rental relief. And so rental relief didn't do as well in our House budget as it did last year, because there's a way more money in this federal dollars.
Yeah.
One of the priorities that I've had, I'm hoping to include, been working with the administration to have a common system to apply for social benefits, so that there's one place where you could apply for food stamps and Mass Health and some of the other programs.
Yeah.
And I think we're closer than we've gotten there, in large part because we required the administration to hire a consultant to figure out a plan. The plan was done by January of last year, and CARES Act money was used to implement a lot of it last year. And I think the final stage, I'm hoping we'll be able to fund with some of this money. And that to me is a great one-time thing. We need to do this once. It's cost once. And so hopefully there's a lot of just improving our government things we can do with that money that we otherwise might not have been able to do.
Makes total sense. I think that's a great idea. Well, Representative, I can't thank you enough for your time today. I thought that was a great conversation. I know all of us and our guests today are eager to get back to the State House and see you in person at some point soon, hopefully.
Yeah.
And we look forward to working with you in your role on healthcare financing.
My door's always open. I really enjoy this discussion and all my discussions with MassBio and the other biotechs in my districts. I always learn something, and I'm always appreciative of that. So thank you.
Thank you. And thank you to today's sponsor, Sanofi again. We have 2 more Policymakers Lives coming up in the following months. June, we have Senator Adam Hines, who's the chair of the Senate Committee on Reimagining Massachusetts Post-Pandemic Resiliency. That will be a really interesting conversation, given all the changes that are happening in the near term. And then in July, we have Representative Bill Driscoll, who is the chair of the newly formed Joint Committee on COVID-19 Emergency Preparedness and Management. I know he and the committee are doing a lot of on-the-ground research about the response to the COVID pandemic, including what the life sciences has done. So we look forward to talking with him in July, and we hope you will join us for both of those events. Thank you again for joining. Thank you again, Representative. We'll see you all soon.
Thank you.